My goal with an informed consultation for a prospective patient is to help the patient avoid making the three most common mistakes associated with hair transplantation surgery. First, a wide disfiguring scar in the donor region. That typically occurs from excising either too wide of a strip or doing an inadequate closure and removing the sutures too early or too late. We try to avoid that by using long, thin strips and limiting skin tension, and putting in deep sutures which eventually dissolve but take the load off of the skin edges so that the scar stays nice and small. At this point I've done over 3,000 facelifts. I feel confident in suturing up scalps really as good as anybody else can do so. The second mistake is bringing the hairline too low. Typically our younger patients want to have a hairline just like all of their friends do, right across here. But when you reach 40, 45, 50, a hairline here tends to look abnormal. So even on our younger patients, I tend to push a more conservative and higher and receding hairline so that they look normal not only at 25, but also at 35, 45, and 55. Occasionally we lose patients because I won't do as low of a hairline as they want. But in my opinion, it's better to plan for the future than to have instant gratification at 25 and have a regret at 30. And the third mistake with hair transplantation is too little grafts over too much bald head. For example, if I can get 3,000 grafts out of a typical person's strip, and we use that to really pack an area approximately the size of my 4 fingers and part of my palm, most likely that person is going to be satisfied and notice a tremendous change in their scalp's appearance. However, if we take 3,000 grafts and sprinkle them a little bit in the front, a little bit in the middle, a little bit in the back, and a little bit on the crown, typically you haven't accomplished anything except for deplete their checking account and give them a scar on the back of their head and make them look more like a chia pet. So we tend to pack one area